Hi, Dr. Gary Rademacher here from Injection University, and to my left is Karen Rea from Injection University, and today we wanted to review with you some benefits of the Provider Protection and Enhancement Plan. I know you've been getting a lot of information on this, but we can't stress enough how important this is, and so we want to go over two benefits today. The first one is on Zoom meetings. So Karen, can you discuss the reactions you've been getting with the Zoom meetings you've been doing?
Definitely. So I do a Zoom meeting on the first and third Wednesday of every month. Last night, I had two really great studies and articles. One of them was the University of Miami. They were talking about patients with COVID, and they actually had STEM IV in a level 1 randomized controlled trial study. And everybody that got STEM in the randomized controlled trial was actually a full healing and discharge within 14 days. And at 4 weeks, they had full recovery. So, and the people that didn't, unfortunately, majority of them actually passed. So unfortunate, however, we were able to discuss a lot of really cool information and answer a lot of questions that providers have, and they need to be able to ask somebody who's done this. So it was really cool to have owners and medical providers on the call and able to help share some knowledge.
Yeah, awesome. We're getting rave reviews on that. So you definitely want to get on the Zoom calls. This will actually create more confidence with the providers when they understand studies, they understand procedures, and the more confidence one has, the more certainty one has. And the person who has the most certainty in a room, AKA your report of findings room, or when you're giving recommendations, wins. The most certainty wins. So the next thing we want to discuss is I'm going to share my screen, and we are going to actually show you a video. So the video is, we get questions on, you know, how do the videos look when you can log online and watch videos? So this is an example of an injection that actually shows not just the injection site, but also the ultrasound guidance picture as well. So without further ado, here's a video for you.
Knee injection is our next injection. Patient is upright, seated. I do have them forward. I like to be able to put one finger behind the calf so that gravity automatically takes over and opens up that knee joint. Palpation, quad tendon, patella tendon, just on the lateral border and the medial border of the patella tendon, just below the patella, is a sulcus. Those are your entry points for your knee injection. Your needle will be flat, and it will be angling at a 45. It will be angling back in behind the kneecap into the knee joint. This is an intra-articular knee joint injection. This is the #1 injection I do all day long, every day, especially with regenerative medicine. So it is not uncommon for the patient to naturally kick. So I do protect the leg from coming out and hitting me or messing up any of the injection. So transducer, non-dominant hand, my orientation, I'm going to place towards her head to start, right over the patella tendon. And when I look at the screen, make sure you put your parking brakes on. When I look at the screen, on the left side of the screen is the patella. In the middle, you'll see the patella and the patella tendon on the right side of the screen. So I've cleaned the joint space. Thank you. And here we go, a little pinch right into that sulcus, directly in, and it should slide like butter. Once I'm in, I'm changing my orientation right up next to the needle. And then you'll see on the left side of the screen, that's the tip of the needle with me wiggling, and that's me injecting. And there we go, knee injection.
So there you go. That's a quick example. And the value of this is if the providers, if they have gone to the training, the live training, the 2-day and the 1-day training, and they haven't done a treatment, let's say for plantar fasciitis in 3 months, well, they can do a quick review. They can come to this and they can actually get a brush up on what they learned with Karen when they are at the live training, and it will help them be more confident and certain in that procedure. And so we have also some future dates coming up. Some of the benefits also of the Provider Protection Enhancement Plan, if you're on it, is that as you are expanding and growing and you're adding providers, if you add a new provider, you get a 25% discount. Also, providers who go on to the 2-day and the 1-day training, we really highly encourage people to go every year to actually brush up on the skill set. Repetition is the mother of skill. So they can actually attend at 50% off. So you want to take advantage of that. So Karen, when are the next dates that we have coming up for live training.
Yep, so the next 2-day training is February 12th and 13th, Friday, Saturday here in Denver. And then there is a 1-day training in Chattanooga, Tennessee, February 25th. That course is totally full. However, I am creating another 1-day course in Denver in March, and the date will be announced as soon as I secure that date. But I am creating another 1-day. So hope to have you there.
Awesome. Thanks for tuning in. Have a great day. And hopefully you are serving and helping many, many people. Take care. Talk to you soon.